So here we are doing the presentation for recruiters. So it's obviously you're a professional. So it's a professional skills app. What I'm bringing to the table is a skills app. You're gonna gain some skills so you can reach practices and connect them with the professionals that can satisfy the practice needs. Now, Scott, there is a problem that the practices, they may not even know that this is such a big of a deal because even the words, the nomenclature is new, and this is one of the first problems or one of the first confusing factors. This nomenclature of functional disorders and functional neurological disorders is new. The old terms that we are avoid using, psychogenic, psychosomatic, conversion disorder, does any of those ring a bell?
Yes. Psychosomatic is, and correct me if I'm wrong, but it is a physical ailment that your body creates itself. Like it's in your brain, but it's not a real symptom or it's a real, am I on the right path there when you say psychosomatic?
So it is not real in terms that we cannot see its objective evidence. We don't see it in testing, for example, in test results. The structure, the anatomy comes back as normal. All the tests are normal, but the patient has these bodily symptoms, nervous system symptoms, that it's like it's produced by a dysregulation in the energy, electromagnetic energy. This is why I became passionate about this and why I studied clinical neurophysiologist. This is why you contacted me. I studied the electromagnetic energy of the nervous system with the EMG, the EEG, right? So my field is electromagnetic energy, and these are conditions that are electromagnetic, but they come and go. The symptoms appear and disappear because it's energy. Go up and down. So when they go to the testing, even in the EMG and the EEG, they don't pick up anything there because it's not a fixed problem in the structure that we can measure. It's still energetic. Anyways, you got it, right? We're understanding one another. Okay, great. But now this is really important because we're already starting the education for your team, for you, and for the field. The name now, the real name, therefore, is functional disorders. That's a large umbrella you're going to see in a moment. And when it comes to nervous system, we call it functional neurological disorders. I can share the presentation. You can read the disclosures later. I'm going to also put it online so you can share it with your team and brainstorm so you can read this later. So what am I talking about today? What is this professional skills app? What are functional disorders? What am I offering? Because here you have me. You contacted me yesterday. And I said, Scott, I have something for you, but we have an understanding barrier. I am providing education for all practices out there, and I am bringing a treatment model, and I am helping them treat their patients. So I am educating them in this new field. They never, Scott, listen, they never received medical school education on this field. This is brand new. You're tapping into a new industry. They never received medical training, nor residency training, nor there is mandatory CME or ABPN, American Board of Psychiatry and Neurology requirements. We're in a void right now, a void that is costing millions and billions to the United States and the world. So if we develop a model here that works, we could even sell it or share it internationally to our partners in other countries. So is it all worth my time, my training? Like, what is Yadira talking about, Dr. Velázquez? Okay, let's keep looking at the data. So you will be reaching practices and saying like, hey, I have something around FND and functional disorders that you may be interested in. So they may be like, what? Like, what are you talking about? Because people are still in the old terms. So yeah, this is the new term for conversion on psychogenic. But this is how frequent it is. So this is a disease that is affecting all practices. Look, Scott, psychiatry, psychologists, physical therapy, neurologists, primary care, ear, nose, and throat, because the nervous system innervates the entire body and sends electricity for the entire body to function. The manifestations are everywhere. So the ophthalmologist sees these patients, the gastroenterologist, the cardiologist, the rheumatologist. So this is everywhere. So it's an umbrella. So depending on the practice that you're calling, that you could be a primary care recruiting, you can be a critical care, you can be an emergency room. These patients are in their department, in their service, and they are struggling, providers and patients, because they didn't receive medical education or residency training education. Patients are suffering, and doctors, nurse practitioners, and physicians assistants are suffering. What is the treatment? Are patients getting better? Can I really help the practice with something new? And again, who is looking for these services? So I already told you, it's an umbrella: rheumatology, fibromyalgia, cardiologist, neurology. Many symptoms. All these are names that are in the ICD-10. This is the newest nomenclature. Every practice you can reach. So is it worth my time? Is it worth the practice's time? How common is it? It's increasing in children and adolescents and adults. It's the commonest illness affecting the human nervous system, and is very frequently also diagnosed in rheumatology, in cardiology, and so on. Long COVID is considered a functional neurological disorder. It's spreading through social media. The USA spent $256 billion in 2013 alone, before COVID times. This is bigger now, because I'm telling you, there are new diagnoses like migraine, long COVID, TikTok tics. This is gaining media attention. And patients, sadly, and I don't want this, if any patient come across this video, I don't want patients to feel alarmed in a detrimental manner, but I want everyone to take this seriously, that the data have shown that these patients can kill themselves because they are so lost in their treatment. No one is helping them. And sometimes they die because it's a problem in the electromagnetic energy of their system. So we have to take it seriously and know that there are things that we can do, and you have a key role because you connect people, practices with people who can provide a service. This is the meeting that happened 4 months ago, the biggest global international meeting where the UK was there. African countries were there, in America. So they say like, hey, this is increasing now. ADHD and autism is there. And this is becoming larger and larger. The treatments are too, and I can tell you, they are not solving the problem, because these models are the old school models. Like, they haven't catch up yet to all the new evidence that is coming up. I have a research paper that talk about the deficiencies in treatments, about we don't know, and even that the names are changing. So all that's material that I can send you that we can provide to the practices when we're first making that connection. So I'll give you all the material that you need to do your work. So how common is it? Well, so far, it seems like it's quite common. But who is at risk? Who gets this? What is this? Why is this happening? So when you look at the data, this is in the paper too, is people who have gone through all sorts of challenges and adversities and stressors and trauma. And changing houses, changing jobs, undergoing a physical injury. These are very common things in modern society. This is why it's increasing, it's gaining media attention, it's being more common because modern society, there is a lot of this and confusion and changing relationships and people mistreating one another. And it's tough out there. It's kind of a pandemic is caught because there are a lot of risk factors. It's spreading through social media. There are even TikTok variants that are named after TikTok. And there are no preventive strategies because epidemiology hasn't catch up yet to preventive strategies. So it's kind of a pandemic and we have to act on this. Okay, so now what? What can we do about it? We're here. We know the problem is there. The area is in need for professional support. So what can we do? Why are we here? So have been learning a little bit. We can understand it, right? It's kind of simple. We can make it simple. We can try calling people, you doing your job and reaching out and seeing what people respond. And then we can have a few meetings to figure this out and how we go about the skills up and the professional development. And whether by healthcare can become a leader in the field, because I told you at the beginning, you're the first one that is receiving this presentation. So this is interesting, actually. As we collaborate, we can do research because I'm a researcher. So whatever happens in our collaboration, again, we can export it to other countries. We can share it with other recruiter companies. There is tremendous room for professional expansion because this is new. And what else? I don't know, because you have to tell me also. And I'm going to finish because all this, you have it in your presentation. I will give you things to share with your clients. I will give you the science. I will send you the papers. We're going to make it simple. I will teach them all this. You can share this with them. We can read this, a little bit of what can offer them. For example, we're going to teach them to, for example, when you call them and you say like, hey, how are you doing with functional disorders treatment? I'm a recruiter serving you in your functional disorders need. They are going to be like what? And then you're going to have to give him your sales talk, your educational talk. Hey, functional disorders synonym with psychogenic. I bet you see them in your practice because it's common. You got no training, and I have the solution for you. And then, well, what can you offer? Yeah, psychogenic, it rings a bell. And you tell them, yeah, but we're no longer using that term because patients don't want it. So that's the first thing. But you say like, yeah, so let's call it functional. So I have a provider that is doing education, a 5-week educational course. And that's what I'm bringing you right now. She's going to teach you about treatment, about prevention, about what causes the disease, about it targeted. She does real patient demonstrations, collaboration, like in the old school medical time where you bring the patient to the classroom and everyone's here. That's part of my courses. You let them know that they can establish themselves in this new field with professional excellence. Their practice can have more success. They can gain reputation. They can become a leader in the treatment of these patients because there are no leaders yet. There are no local community leaders yet. They can create their new professional careers. And for example, I'm creating a functional wellness advocacy, which is similar to a social worker, but are patients that take on the role of a social worker. We can sell this to social workers too. So we train their staff. And Scott, my course is 5 weeks, 5 hours, 1 hour per week. It's very light. We're going to talk 30 minutes. Imagine to bring a real patient and do some exercises with the doctors and the clinicians and train them 1 hour a week. 5 weeks, that's not much for all the things that they can gain. But of course, we have to talk a little bit more and see like how we do the bridge. Then I can share a little bit of this, like what are in the classes. This is science. They are going to like this. What are some of the things that I teach? What are some of the tools that they will gain? A lot of material for them to understand and foresee what is their interest. We touch into social aspects. I teach them to target even the family. It's complex, but it's simple because I have simplified it because we have to be efficient. I am a doctor. I know how busy we are. So whatever we offer practices, it has to be efficient. We have about 9 minutes and I'll take your questions.
And when it comes to like the training that you're offering, would it just be you or others in your group that would also go do training, or is it just you right now?
This is a model that I have developed. You see, I took off my clinical practice for 3 years and I dedicated myself completely for 3 years to this model. So it's something that I am the expert and I am teaching, but the model is being applied already in collaboration with, I am training it to other physicians in other universities in collaboration and research, and also to patients and non-profit organizations in collaboration and research. But no other physician yet has gotten to my level of expertise that can also teach the training. But in the future, that is my hope. I cannot be the only teacher. That would be too much for me.
I was going to say that would be too much to take on, especially with the time constraints. Okay. So for next steps, my thought process, and tell me what you're thinking as well, is the material that you gave me, I want to share it with my team, with my leadership team first, and then see what, how we could possibly adapt it going forward because we do reach out to facilities and say, hey, how is your coverage for, let's call it endovascular surgeon? Do you need one? And we can start implementing some of these questions that you were talking about is, do you have any, what is your experience with FND? What does that look like? We have materials that we can help with and kind of go with that way. However, I say that, but I have to have that. I've got to get approval, obviously, from my leadership team in order to be able to do that. So that's why I want to be able to share it. Yeah, I want to be able to share it.
For sure. And then because Scott, as I said, we're tapping into a new field. We're trying to create a new service for a big need of the healthcare system. And our population are brothers and sister human beings and doctors out there. This is a real big need, and we're trying to create a new service. Of course, there is going to be a process of perfecting the service and perfecting how we show them, how we explain the service, because again, it's a language also understanding. So count me in for clarifications. We can have meetings, I don't know, maybe a couple times a month because I'm so busy already, but we could have one meeting every couple weeks. Or if there is a pressing need and you guys are excited, we could have a couple weekly meetings at the beginning and then spread it out. I'll see what I can do, and I want to answer your needs too. And we even, in one of those meetings, we could design together some screening questions for the practice to facilitate the communication when you call them. Hey, like, how are you doing on endovascular? We can design together 5 or 6 questions that you can share with your team that will be easy to establish that common understanding of what are we talking about here. I can create video material that you could send them in your email. We could create recruiting email material together. We're in this together. This is my career. This is my life. And we are now possible collaborators. Let's see what your team thinks.